Dear colleagues, distinguished partners and friends, it's my great pleasure to welcome you to the Highway to Helsinki stakeholder meeting and to our shared journey towards Radical Health Festival Helsinki in January 2026. The festival brings together health professionals, researchers, decision makers and innovators, all those who share a commitment to building a healthier and better future. And that's precisely our goal here in Helsinki as well. Helsinki's new city strategy, a Helsinki we can be proud of, gives us a clear direction to this work. It describes the kind of future we are building, a city that is humane, safe and sustainably vibrant. Our strategy emphasizes trust, collaboration and proactive well-being. This means that we invest in well-being before problems arise and thrive in their day, receive help when they need it, and also have the opportunity to live a full and meaningful life. We're also advancing this thinking through the AI for Healthy Cities initiative, in which Helsinki participates alongside global cities like New York, Basel, Lisbon, and Singapore. AI for Healthy Cities was initiated by the Novartis Foundation in collaboration with Microsoft AI for Health. The initiative aims to improve urban cardiovascular health by harnessing the power of artificial intelligence and data. Through this research, we are learning how urban environments, socioeconomic conditions, mobility options, and also access to services affect people's health. This knowledge enables us to make better, more targeted decisions, supporting well-being for everyone, regardless of, for instance, neighborhood or life situation. Data-driven leadership is a cornerstone of our Helsinki strategy. The theme of the Radical Health Festival, Operationalising Precision Health, let's make it real together, fits this moment perfectly. Precision health is not only about personalized care, it's also about accurate and timely well-being policies. It's the ability to identify risks, understand causes, and act early for the good of people and society. And that is exactly how Helsinki operates. A city built on knowledge, equality, and community can lead the way in how health and well-being are shaped in the future. AI for Healthy Cities is a great example of how international collaboration and local insight can reinforce one another. We, of course, learn from each cities, from others, and at the same time, we share our own experience of combining data-informed leadership, social justice, and human-centered services. Finally, I want to warmly thank all of you who are contributing to this journey here in Helsinki, online and around the world. Together we can make Radical Health Festival Helsinki 2026 more than just an event. We can make it a movement, one that demonstrates how cities working together can advance health and well-being globally. In this work, Helsinki aims to be a trailblazer, a city that brings together research, innovation, and humanity, a city we can truly be proud of. Operationalizing precision health, let's make it real together in Helsinki. Thank you and warm greetings from the City of Helsinki.
Welcome everybody to the stakeholder meeting. We thank you for being here. This is the Highway to Helsinki. We wanted to share some recent updates that we have with you. If we go to this next slide, we see we wanted to highlight and thank our advisory board. Also, we're going to have the message we had from Juha Jokinen, who's our co-chair of the Festival Advisory Board, along with Päivi Selonaka. Here is just across here, you can see the different organizations that are contributing, collaborating, and partnering with the festival. So it's not one organization, it is all of us doing this together. We'd also like to highlight and share and thank all of our partners, whether they're contributing on the program, whether they're supporting us with audience and their community, or there are media and community partners, just to show, highlight some of these new partners that have just come on board with us. And we'd also like to thank some of our industry partners that have been joining us along the way and will be supporting us. One of the big themes for the festival is public-private partnerships. A few new things that are happening for the festival that are radical in 26. There's a big, strong focus on deployment initiatives. So we really, as our tagline says, radical in actions. This is something that we really want to see. So if we can get more actual projects that are happening to showcase those. We want to also look at less PowerPoints and more audience engagement. So having panels, having discussions, but also interacting with our audiences, and just not to have presenters read slides, to be a little bit more radical in their approach. A new concept that we're going to be talking a little bit further in the program with Pascal will be the Innovation Village. This is a new content area for startups, investors, along with bringing all of our delegates to see these companies and what the future could look like. As we mentioned about the radical format, we want to do things like unconferences, fishbowl, slide roulette, where we could slide roulettes like bringing the audience, having a few topics that we highlight, and then it just gets selected, and then they can bring them on stage to talk about. Another key area we're going to be integrating in between the sessions throughout the 3 days or 2 days is going to be some brain openers. So this is going to be a couple of times a day. We'll have a speaker come on stage, and we'll be doing some breath exercises to integrate our personal health with what our mission is for the festival. And lastly, the roadmap for us is more, this is a, Radical Health Festival is a mission. We're not just an event. So how do we turn health systems into precision health systems? So this is one of the mandates that we started with the project in 2023, was to really focus on creating this vision, creating this movement. So this is really going to be one of the key areas that we're going to continue down the roadmap with, how to turn the health systems into precision health systems. So stay tuned for that.
To give you a snapshot, I think we talked about who we plan to have coming, but now it's actually happening. The Finnish government has been sending, I think, over 60 invitations so far to be in some of the sessions, but also inviting trade delegations to come over to Helsinki in January. And the response has been very positive. So the one thing that I do ask all of you is we need to make sure we send good vibes, that we get lots of green light in the sky in January. It can be still snow on the ground, but we just need to make sure that people feel like they're getting the northern lights while they're here. Seriously, like Germany, Switzerland, Austria, the Nordics, these are all countries that we have been collaborating with, and that with the government, we're bringing delegations to come here. So this will be an international event. We've been working with a lot, as you might remember, the last 2 years, we've had at least 12 to 15% clinicians, which in digital health events is quite a task to get those people to come. So we've been working with the European Society of Cardiology, we've been working with the Finnish Medical Society, and we will talk a little bit more about how we're trying to link doctor days with us and have at least a session combination. And we've also just announced that the Finnish Nursing Association is going to host a nursing symposium on Tuesday for nurses. I think we'll get a lot of local nurses, but there's also going to be some coming down, and they'll have access to the festival for all 3 days. I think there's already 30 nurses that have registered, so we're really happy about that. As I mentioned, we do have a good target with startups and investors, and we'll share more details about how this is going to be implemented. But as you know, the festival is inclusive for all. So we want to keep drawing on those communities and bringing all stakeholders to the table with us. Next slide. I think now I'm going to introduce you to my colleague, and he's head of the program, Mr. Pascal Laudier. You're on mute, Pascal.
Hello, everyone, and to those of you gathered in Helsinki, I want to say hyvä päivä. This is a pretty complex matrix, so I won't go into a lot of details. I think what you need to retain from this slide is that, as Juha Jolkonen was saying, we are exploring the theme operationalizing precision health, which in other words means that we're exploring how we can start the precision approach before the onset of a disease. So there will be an important focus on primary, secondary, and tertiary prevention. The other thing to retain is that it's a 3 full-day conference. Last year we had 2.5. This year it's 3 full days. We will go in details, but basically day 1 is our partners and their activities, their content. Of course, they continue to contribute to the rest of the event. Day 2 starts and ends with a keynote, but in between we have now 4 streams, which is quite new, as we added an innovation village. So this is really about creating another stream of content that is specifically targeted to the health innovation, the grassroots innovation ecosystems around Europe. And then day 3, we will start with a keynote, then we will have 3 tracks before lunch, 2 tracks after lunch, with a special focus on EHDS, thanks to our very key partner, Etel, who will give you a little more details about their plans later on in that meeting. We can advance the slide. And again, I'm not going to go through all of these key program developments. First of all, because you know how to read. But I think some things that are interesting to note is that we have about 80 to 90 speakers confirmed out of an estimated 140, which means that we still have room to include topics. We still have room for your suggestions. And we expect that, you know, the program will really be 95 or 98% done by mid-December. But we're going along and we're doing well. The Finnish Ministry of Social Affairs and Health has recently sent 60 invitations to high-level stakeholders from other ministries, other health authorities around Europe and beyond. So I guess my message is, if you want to include something new into the program, now is the time to speak. The other thing that we slightly changed from last year, having a discussion with patients and patient advocates, was that maybe we should give the opening words to patients this year, so that we keep reminding ourselves throughout the day that whatever we do, whatever we decide, whatever road we take, it is for patients, with patients, and to improve not only just financial outcome, but also health outcomes. And one last thing, because we have the luck this year to be back-to-back with Dr. Days, we have discussed a session that would be a transition between our event and their event. So Dr. Days is put together by the Finnish Medical Association. We will welcome their delegates on day 3, which means that it will be a busy day. And then in return, they will welcome us to their opening reception. We can advance to the next slide. Okay, so starting with day one, we dedicate this day to partner events and site visits. And the site visits are curated with the Finnish Ministry of Social Affairs and Health, based on what people are coming to Finland to see and experience, and also with the support of the City of Helsinki. I will let you discover what's on the program, but we definitely want to talk about procurement, about EHDS implementation. We want to talk about finance, because we won't achieve anything with good thoughts if the financing system is not following. And I think with this, we can move to the next slide. Again, I'm not going to go through all the themes that we are co-curating with the Finnish Ministry of Social Affairs and Health. What we need to retain from this slide is really that we want to talk about public-private partnerships for innovation, for value, for sustainability. We want to make sure that the data is there so that innovation can happen. We know that data is a barrier in many cases. We want to talk about AI. We want to talk about innovation pathways. And all of this, what we want to do is, because we're working with the Finnish Ministry of Health and Social Affairs, is have a little bit of a lens that is about policy. So we can go to the next slide. This Health and Bound, maybe it's worth explaining a little bit what it is about. This is a track that we're co-curating with the City of Helsinki. And it really, the premises of this track is about the fact that only 25% of our state of health is biologic. The rest can be genetic, it can be environmental, it can be lifestyle, and this is what we want to explore. So when we say Health and Bound, what we want to explore is all the places from home to work to the city that we live in, all the places where health happens and should be promoted. And we're very thankful to the support of the City of Helsinki to help us make this track happen. I think we can move on to the next slide. So that's our data, AI, and the EHDS. Obviously, our theme this year is about operationalizing precision health. And without quality data, there's no precision at all. We're shooting in the dark. So this track is really about how we can leverage the data that we have. How can we better improve the quality so that what we feed into AI is actually quality data and fair data, equitable data. This track is co-curated with the Radical Health Foundation, which was created to very recently with the objective to promote precision health around the world. We can move on to the next slide. One thing that I forgot to say is that Mark Lange from ETEL will also tell you more about what they are going to do in track 3, data, AI, and the EHDS. They will have their thought leadership symposium on EHDS. It's coming and we need to get ready. The Innovation Village is really a new stream of content, and it's an area where we think that we should allow ourselves some flexibility in terms of formats. So we're welcoming unconferences, we're welcoming Pechakucha, we're welcoming, and actually we're already planning a session on women's health that will be a double fishbowl. So not just a fishbowl, a double fishbowl. It's the place where we can have focused presentations that are more targeting the startup and grassroots innovation movement and the ecosystem that supports it. So startup pitching, this is the place for the matchmaking activities. We know it's hard for hospitals, on all the people on the buyer or investor side. It's always very hard to find the right solution for them. So we're trying to make this a little more efficient at the event. And so this is an example, the Innovation Village, of what Sean was mentioning before. This is not a conference. It's your space to bring on what your vision, your line of work, your reflections, and the Innovation Village is really there for that and is open to your suggestions. And on this, I think I will end my part of the presentation. Thank you.
Thank you, Pascal. Really appreciate that. We have two more speakers joining us. One is going to be Marc Lange, but then also Mikael, who's here live in Helsinki with us. He'll be joining after Marc. Marc, are you there?
Yeah, I am there with you.
Okay. We go from Menorca to Brussels, Belgium.
Yeah. But I'm still having a pullover, so the weather is still cold. It's already cold in Belgium. So thanks a lot, Sean. Thanks a lot, Pascal, also for this introduction. You have seen that slide is just to show you where ETEL is connected into the Radical Health Festival. I would like here simply, 2 points first. First, for those who don't know necessarily ETEL, we are an NGO based in Brussels. Our mission is to facilitate conversations between all types of stakeholders. So that's a very important point. Multi-stakeholder approach with industry, with the public sector, with clinicians, with hospitals, with patient organizations, of course, with health insurers, innovators, and so on. So bringing around the same table, creating conversation around the same table with all these profiles, all these stakeholders. So our conversation, by definition, are always multidisciplinary. And we do that since 25 years, so even more now. So that means that we have here some experience, and we have observed very closely how health telematics, then e-health, and now digital health has evolved over time. So that's the first point. The second point, the second point is that we are very happy here to build a synergy with the Radical Health Festival. We are present for just the third time, so we are present since the beginning as a partner, but this time we are really reinforcing our participation. Why? Because there's a lot of things that Sean has mentioned, which are resonating to us. We are not a conference. We don't want to do a conference. We want to engage people, the audience. We are having in mind developing roadmaps. All these elements are very much music to the ears of ETEL's people. So that's why we are very happy to develop this synergy and combine this year's symposium. We do symposiums since the beginning with this year's symposium with the Radical Health Festival. The topic of the Radical Health Festival, Pascal mentioned it, but here I would add we have extended a bit the title by including in the title, let's get people and data ready, and it's very important. Data, we have discussed that a lot, and ESGS, of course, it's obvious it's about data, but without people, there will be no data, no quality data available. And that's really the key element here. And you know, EHDS today is coming. That's clear. The regulation is there. Specifications for creating this data space are in the process of being done, but we don't have to wait for this specification to be adopted. We need to start now to be ready. Why? Because there is a lot of different organizational elements to take care of, a lot of different changes in our culture, changes also in the way we will be working in the future. You know, EHDS is such a game changer that it will impact the healthcare systems in a very deep manner. So that's why we say, let's start now before the specifications are available. Let's start now to prepare ourselves and to get ready. Next slide. How do we plan to organize this? We will have 4 sessions, each of them dedicated to EHDS and EHR systems. That's really our focus. We don't work on what we call the secondary use of data. We concentrate ourselves on primary use of data and on making data ready to be used for secondary purposes. So 4 sessions, each of them, and you see here the first 2, each of them will be supported by a working paper. We are working on this working paper now. We are even already engaging the members of FETEL in developing these working papers, and these papers will be circulated to the audience of the symposium somewhere. We don't know yet whether it will come with Christmas time, just before Christmas, or whether it will come after with the New Year. But at least they will be circulated ahead of the symposium, and everyone will be engaged to go through these working papers and then to prepare themselves to contribute actively to these sessions. One session is very much about the practicalities on EHR systems. Which systems, which include data, the data targeted by the regulation, which systems will have to be connected, will have to be interoperable, or how will this interoperability be organized? It's for hospitals, for policy, for GPs. That's really big questions at practical level, and we will be reflecting on that. Very operational, very deployment oriented. The next topic, the next session will be about AI, inevitably, but AI here to help EHR, or to enable EHR systems, or to enable those who are producing data to provide data in a structured manner. That's really a key element. Without structured data, without quality data, the EHDS will not deliver promises, and we will be in this bloody scenario of garbage in, garbage out. So here, very important, and with this session, we will explore how can AI help to make data having the right quality and having the right structures to be interoperable. Next, again, working paper is in preparation. Next slide. And it's the last one. So next slide, 2 other sessions. We will then not only work, again, back on AI, but AI in the relationship with EHR systems. And here, while in session 2, we are concentrating on how AI can help to have a structured data, we will here reflect on how EHR systems can really provide AI systems, AI tools with real-world data on a continuous basis. There are a number of constraints, there are a number of requirements, and we are working on that. We will even have run a session in early December to open up the conversation on this topic, again based on a working paper, and then we'll come to you to Radical Health Festival with an even more mature paper. And then last but not least, very much oriented innovation, and we need to reflect how with Pascal and the festival on the relationship between this session and the innovator, the session track 4, the innovation platform. We will here concentrating on the fact that with the regulation, 500 million of inhabitants in Europe will have the right to download their data from EHR systems. 500 million of inhabitants. So that creates a market, or that creates a domain for innovation. And we would like really to reflect on that and to reflect on how to boost innovation, to take advantage of this opportunity, to enable individuals to share, get their data, share their data, and more importantly, to get value out of their data by getting apps, getting support, getting tools that helps them to exploit their own data. So that's the 4 sessions that we are working on, each of them relying on a working paper that we will be circulating ahead of the symposium. And then we will, during the event itself, find a way to create interactions with our panelists and with the audience to really engage everyone in developing further this, in getting more ready than ever for the EHDS. And I thank you for this. We'll end my presentation with this slide. Thank you.
Thank you, Mark. I really appreciate you being with us and sharing this insight for us. Now we'd like to bring up Mikael, who's here in Helsinki with me, to talk about the collaboration with us with IHE Catalyst and HL7 Europe. And this is a Nordic Health Data Hackathon we're looking to do. Mikael.
Thank you, and hello, everybody. The HL7 Europe logo is not correct right now because we don't have official agreement with them, but this program has been initiated by HL7 affiliates in Norway, Sweden, Denmark, and Finland. So these country affiliates are all working on implementation guides. Hey, there are technology standards, interoperability standards that help healthcare IT systems exchange data between each other, and we have beautiful specifications, but sometimes it's hard to show what can be done with these specifications. And one powerful tool to advance that knowledge is hackathons. So we invite industry and all interested parties to bring their systems, and then we spend some time hacking things and tools together and show that, hey, if we have this capability in the systems, this is what we can actually achieve with it. So mainly technical, geeky stuff. And this is what we are advancing. We are doing this. Next slide, please. I can't advance it here. Yes. So as said, 4 country affiliates of HL7. We start in November in EHIN conference in Norway, Electronic Health in Norway, so Electronic Health in Norway. And then this Radical Health Festival in Finland will be the 2nd installment. And then we continue in May in Vitalis in Göteborg, Sweden, and then go to Denmark. And we are not entirely sure which event we select there, but Q3 26 it will be in Norway. So the idea is to always keep these events tied to some big industry event in that country, so that we know that many of the relevant people will be in that city already, and we can get the maximum benefits out of these events. Next slide, please. And this is the Finnish Health Data Hackathon. It says 0 day of the festival. That's my error. So it's first day, anyway, the Monday. And we'll at least gather then. And we have some preparatory webinars already in December. So we want to tell all the participants, these are the systems that will be present. These are the apps that will connect to these EHRs and all of that. So a lot of preparatory work there, but then we will collect on Monday, see what we actually have done and how we present that. And then we are in discussions with Sean and Pascal, how do we tie this into the Innovation Village program, but we aim to present some of the greatest achievements of the hackathon there. And the program of the hackathon, we've already selected 2 important topics because we know that there are partners that want to work on those. First is patient access to health data. As Mark explained, XShare will be here explaining the yellow button concept and so on. And we have others like Kela in Finland opened that kind of API in last December. And HL7 Finland has published a FHIR implementation guide on the topic. So patient access to health data is a big one. Then we also have companies interested in certain parts of care plans. So we have Duodecim, for instance, that have structured care plan definitions or established best practices for each disease. And then we have client applications, so apps for patients that would then guide the patient through that. And then also apps for practitioners, healthcare organizations. This is how you actually track that all the necessary treatment has been provided and to whom. So that's the agreed on topics, but we will be evolving this program up until the last minute of Wednesday, the 22nd of January. So this will be radical and constantly growing and evolving. Next slide, if I still had one. No, I didn't. So be in touch. It's Heidi Hakala, it's the current HL7 Finland's FHIR ambassador and officially part of this program. And you can also reach out to me if you manage to find my contact information. Or then Pascal and Sean, and they will direct your interest towards me. But we are open to all participants and really want to hack with a lot of systems. Thank you.
Thank you, Mikael. I just wanted to point out a couple of people here in the room, for those who are in Helsinki, just to share. So you met Mikael. Juha, would you stand up? Juha Pakla, he's working as the secretariat of the festival, but also working with the Ministry of Social Affairs and Health and the City of Helsinki. So he's been the liaison, how we bring all of the organizations together. Then Susanna, who's on this slide, who's in the back of the room there, she's with Messukeskus. She's also working from the partnerships and sponsorship side and the expo side for the festival. I think most of you know each other or have met, but I've met some of you before, and so it's nice to, if you haven't met, hopefully I will see you later for those, and we get a chance to talk, or just after this. But this is a really important project that we've been working on, and we're really excited with Messukeskus and the City of Helsinki and the ministry to do this again in January and to be here in January. I say it with a smile because I know it's going to be cold, but I'm excited for the weather. But I think that we really are excited to be bringing the third edition to our festival attendees and the audience, and we really are excited to get more international Europeans here in Helsinki because we want them to see the value and keep growing the festival as we do this. So again, kiitos for being here in person with us, and we look forward to seeing you. If you have any questions, we can take them now, and our speakers are on Mark and Pascal, as well as Mikael or Juha in the room here, if anything. So we can do a few minutes of that if anyone has questions. Yes?
Yes, I'd really love to know more about Innovation Village. It sounds really exciting, but what does it mean in practice? Like how is it organized?
I think everybody can hear us. Pascal's on mute, but I'll just give you a quick. Last 2 years, we did a concept called EC to VC, which is European Commission to Venture Capitalists, where we brought investors, we had startups, there was a pitch competition, and this coming year, we really didn't want to do the same thing because, sad to say, everybody tries to do pitch competitions, and it's a little bit kind of dated and boring, and I think that it's not something that's really showcasing innovation. It's just trying to get companies into that. So we thought if there's a way that we can, and it was one day for a few hours. So what we wanted to do is have something that would be running the entire time with the innovation as content, because a lot of times the sessions that we're creating or co-creating with the ministry or the city and the data track doesn't always fit with new innovation necessarily. So we think there's still a need to have those sessions and that content available, but we want it to be something that stands out. And so we didn't want to have just a side area where people could walk past and see somebody trying to talk to you about their new solution. Some will be demoing. So we really thought this is a great way to bring it as an official session. There's going to be matchmaking as part of, to make sure that investors get to talk to these companies. But we also want our regular attendees to attend, because last 2 years it was very much niche for investors and the startups. So this is now all attendees. You want to say something?
Yes, a quick note on that. So I mentioned if you have systems, apps, anything that you want to work with, be in touch regarding the hackathon, but also if you have some ideas that this is our pain point, this is where we would need some apps, also give those ideas and we can put those as challenges in the hackathon. Hey, if there are any interested app developers to work on this, then that would be perfect fit for the Innovation Village as well.
Pascal,
May I
was there
say
any
something?
comment? Yes.
Yes. I think we've all witnessed that the market is very inefficient. When a hospital system or an investor is looking for a type of solution, I mean, there's thousands of apps and platforms, web platforms that are coming out every year. Most of them are not there the year after because the market is very inefficient. And I think what we're trying to do with our partner Research to Guidance is actually to start with the needs. So we're inviting health systems, regional health authorities, investors, anyone who is on the demand side to actually voice what they want, what they're looking for. And then we'll put the call for applications. We'll select the most, the best fit for the requests and the requirements that were given to us. But I think that's our way of responding, because as an investor, you could look at 10 pitches and maybe none of them are for you, because it's not the right ticket number. Maybe it's consumer, and what you're looking is business to business applications or web platforms. What we're trying to do is reverse it and basically start with the demand.
And the Innovation Village, the sessions are going to run Monday and Tuesday. So that way we get a chance to bring some of the program for delegates who want to attend this, but then it doesn't conflict with the main 3 tracks on Tuesday as much. But in between some of the sessions, there will be the chance for investors and the startups to meet with together, as well as others to matchmake in the area. There is going to be, for some of the startups, right outside of the room, which will run for 2.5 days. So it's part of Monday and the rest of Tuesday, Wednesday, where the startups can have a demo and people will be able to actually interact. We have a coffee break station around there, so it's another chance for people to go through there and be able to, not force them, but kind of encourage them to be able to chat with these new and innovative companies.
And also highlighting that on Wednesday there will be the Doctor's Day people as well. So that's again a path to reach those people.
Yeah. We have another question, I think.
Yeah, I just wanted to ask about, well, how the startups, well, could like apply or get into their, now Pascal said there will be this demand-based way of doing it, but what's the timeline for that?
Well, I think we've already been talking to startups now, so we can get in touch or, through myself, and we can kind of go through that and share as we're putting the program together and how to be involved.
And then, I don't know if I can continue just on another subject.
Sure.
So you were talking about like innovation pathways in the European context and well, the whole different regulatory systems. So I don't know if there's like a focus, for example, on Germany, which is quite a big market and quite heavily regulated and difficult to enter. So I would just, I've got somebody who might be an interesting speaker on that specific topic. They just published a book like last year in both German and English on how to get in there, like not the straightforward normal ways, but also through the insurances, for example.
Yeah.
If that's of any interest, I can give you something from that.
No, that would be interesting. Just as I mentioned earlier, I don't know if you recall, but the Finnish government, Germany is going to be the biggest trading partner with the largest delegation coming. Okay. So I think obviously sharing some knowledge about the the access to Germany, I think would be important. So I think it's something, I think if we can, and Juha's also collaborating with us on this. So if there's a way that we could, maybe keep that channel open, and that way it's a little bit more, and I think we could get support from the German government, is that they understand that this is an important area we want to kind of channel.
I mean, the ministry is a little bit complicated at the moment. But...
Yeah. We'll do it very gently, so to speak. Hi.
Hi. So I'm Karolina Messukeskus from the Global Health Connector, formerly ECH Alliance, and we were partner in 2023. We then organized the Nordic ecosystem meeting. I think we have 50 people from the countries of the Nordics. And on that note, I'm thinking like about the meetup in January, similar to that, but also with Mark, and I hinted this to you already, Sean, about the meetup of the X-Share Community of Excellence. So in Community of Excellence of the X-Share project, we have now more than 100 people. One of them is standing there, Mikael. And I'm just wondering how I can, like, for the meetup of this kind, do you have some like free rooms available, or is it like partnership? Is it something financial conditions that we should take into account? Something that you can maybe...
We can definitely explore that to see what's the best option and how, formal you need a space or something like that, because we want to make the innovation village or an area where people can meet up. So that would be an area in between some of the sessions. But if it's something that you need like a structured time, then we can work with you on, the possibilities there. And we can take it offline to see. But
I think for the Community of Excellence, that could be like less formal probably, and also like, promotion of the festival to the group of people from around Europe.
Yeah.
For this Nordic ecosystem, probably more structured, but yeah.
The other thing is there's probably more workshops that are still being planned that haven't been identified, that we didn't share because a lot of this is still being finalized. So there's additional European projects that are asking for rooms that are bringing groups between 30 to 50. I mentioned, I think it was on there, Valo, which is co-organized with Citra, and Mikhail's involved in that too. He's everywhere. But that's an important Nordic group from the EHDS and in one of the projects that they're doing through Valo. So we're excited to have as many of these and to co-host the meetings with us, where some of them are private, so they won't be open to the attendees, but the idea is to keep those delegates to stay for the rest of the festival so they can have access to the more open programs and sessions. Mark or Pascal, anything else on your side from any of the questions so far? I don't want to only talk. Okay. Any other questions?
I have to, if there are no other questions. I'm a newcomer, so my questions may sound a bit stupid, but anyway, do you plan to do live stream or recording of any sessions, fully or partly? Or
well, streaming might be, we came through some challenges just streaming this today, so it was a good tester, just put it that way.
At least they're offline.
We're looking to explore at least one or two of maybe some of the bigger sessions that we could stream. I think having all of the whole festival streamed is going to be impossible right now, but we're looking to figure out how to record some of the sessions and have some options around that too.
Right. And content-wise, I have a question. The program looks pretty impressive, and thank you for this. Anyway, I'm wondering if you're planning to thinking of picking up on some things, ideas from the previous festival. Sometimes discussions remain unlocked, or some ideas come up, but you want to follow up on this. So do you plan to do some follow-up from the
previous 2 years? Well, I'll let Pascal jump in because he has an opinion on this, I know for sure. But I'll just say that our kind of vision is a continuation. So where we started in 23, we wanted to take from there and go into 24, and now for 26. So we definitely have some of the comments and feedback and lessons learned that we took from 24, and we want to keep moving it forward for this. So there should be some, but Pascal, go ahead.
Yes, what I would like to add is that, first of all, it is a festival. It's not a conference. So it's not just one person, i.e. me, deciding on everything that goes on the program. We're doing that in a very collaborative manner. When we talk about the messages that we may have received last year, I mean, the perfect example is the last keynote was about planetary health. And the topic of the session was if health systems could ask, if the Earth could ask anything from health system, what would it be? And the very first answer was, I think the Earth would say, I'm more important than you. And without me, you're no one. So I should be the opening keynote, and this is what we did this year. The very first keynote is One Health, and it's about saying that, you know, if the health of the planet is not respected, then we don't have our health. There's no option for it. We also have a way to keep some flexibility to have suggestions for different topic, change this session, add another session. We have that flexibility, and what I can say is that we listen to everything that we hear. That's how we build our programs.
Maybe one more question, and coming to the basics, and maybe this is also something you discussed on the previous meeting, like before summer. How do you position yourself versus HIMSS and Health Europe now and those other events? So when we talk about this to the people, I mean, I think changing the time was a great idea. Like January, you know, it's a great time, not May, June, together with HIMSS and Health Europe. But how would you then present this to someone who has to decide about the budget and so on, why they should come to Helsinki?
That's a great question, and thank you for that. I think we've always felt that we were not in competition with either of those. We used to be with HIMSS, Pascal and I, and we worked with the team from Health in North America. That was part of our previous, old colleagues. So we don't want to see them. We don't want to see Vitalis or the German conference as any kind of competitor. I think we feel like we've found our niche and where we stand, and I think it's very complementary to where they are in a way that we focus, differently in some things. I think they have politicians. I think they have clinicians. A lot of their topics are more driven by their organizations, or only maybe they're influenced by their sponsors. So I think what we're doing by having the collaboration with so many organizations is that we're putting their mission is our mission. And so we're putting that first. And companies are now starting to realize that they do have a place and that they can be involved with us. So I think the commercial side is seeing that they can be a part of the solution with us and to support this, rather than just possibly in the other shows where they just kind of follow whatever they want. So we're not trying to. I think having the event in the spring was congested for sure. So you had all of these events then, so that made it more challenging because people had to choose, even if they could attend these, because people do attend a lot. So I think by having this away from that, we're eliminating some of that congestion, but still focusing on what we have. And we're open to collaborate with any of these organizations if they want to. There's the Frontiers Health that's happening in November, who's one of our partners. We've been cross-promoting the two events because we do see segues into where they're doing and where they can take over some of the content and some of that topics, and can continue in Helsinki with us next year.
And if you want, there are conferences and trade events, but there's only one festival. So the vibe is a bit different.
Exactly. Thank you. Any other questions?
have a question back to the audience. So, Carolina, so you had a question about the Innovation Village. Yes, and what was your interest in that? Do you want to explain? Because we want to hear from you as well.
I'm kind of representing both sides, startups, where my background is I'm working for digital health startups, but now I'm running a design agency, which is designing and branding startups, so also doing digital, working with the digital innovations with the UX, branding, marketing, communications, and so on. So both sides, I'm interested in meeting people over there, also presenting my company, and also getting the vibe kind of and the trends, what's out there.
Definitely join the hackathon.
Lots of room for you, for sure. Any other comments or questions? I don't know, Heli or Pia, you guys are involved in the City of Helsinki track. Is there anything you want to share or highlight from the sessions that you're working on? Not to put you on the spot, just want to say hi.
Hi, and Pascal already quite nicely presented our current plans. But maybe Pia, you have some new ideas. Yes, so what is happening, we want to represent the University of Helsinki here, and Health Capital Helsinki program, which is an alliance of all Helsinki capital area cities and universities and educational institutions. So we represent them here, and we've been asked to contribute our projects and ideas to the program track of City of Helsinki. So this is our contribution. There are very cool things happening, obviously, with us, and hot topics right now, maybe to excite you. Of course, the undiagnosed and untreated is something that we really want to talk about, and also health and security. So these are the hot topics right now going on, and this is what we're going to contribute to the program.
Thank you, Pia. Thank you, Heli. Timo, would you like to maybe share your workshop that's happening on the Monday as well and introduce yourself? This was unprompted. I'm just putting him on the spot, so see how.
We are having our own session on Monday in Finnish. It's about health for soul and sense in Finnish. Terveyttä ja soluille. And it will be running from midday until the planetary day starts and so on. So it's free for everybody, but it's in Finnish.
Well, we hope some of you are going to be able to stay with us for today. I'm excited to be here in Helsinki for the fair that's happening right now, because there's lots of great books that I want to look at and see. So if you are able to stay and join us for that, it would be nice. If you have other questions or want to reach out to Pascal, myself, to Mark, Mikael, or Timo, or Pia and the team, please let us know anything we can help with, and we hope that you will be part of the festival with us in January. Thank you so much.